Good evening, every student present here. The topic for today is Respiratory Medicine CBS session, and the faculty that we have here is Dr. Asif Iqbal sir. He is a HOD, Respiratory Critical Care and ECMO Services at Apollo Multi Speciality Hospital, Kolkata. Over to you, sir. Thank you.
Okay, so the student today I will discuss about the respiratory system CBS. So in the CBS, you might get, there is a three table for first one is your lab, second one is your image carbon loops, and third one is your image. So in the image section, you will get the X-ray, CT, and also you will get MRI is very rarely give. In the image section, they will give you the USG image, ultrasound image, or X-ray image, and the CT scan mainly. So in the ultrasound image, you might get cases of abdomen, pyelonephritis, pancreatitis, gallstone, or hepatic abscess like that, aneurysm sometime. In X-ray, mainly the chest X-ray, and or else it may be your gas under diaphragm, the bowel perforation, sometime hiatus hernia. And in the CT, you might get both the abdomen, brain, chest, and all. So today I will restrict my CBS lecture on the X-ray. So someone has to be volunteer again today. So who will take volunteer today? Nidhi, you can do. Okay. Uh, Nidhi, are you there? Dr. Nidhi Agarwal, I'm talking to you. Are you ready to volunteer with me? Anyone can unmute and
Hello.
do volunteer.
हाँ जी सर.
Otherwise, yeah.
It may be
Nidhi, yeah,
some
Nidhi,
parahilar
start.
mass. It looks like some parahilar mass, left parahilar mass, or maybe hiatus hernia, as we are not seeing gas under the diaphragm, gas below the diaphragm in the stomach.
Gas on the diaphragm, you're getting.
Gas in the stomach gas we are not seeing below the diaphragm. So this may be
Yeah.
in the chest. Hiatus hernia may be there.
Parahilar is there. So, what is the common cause of the unilateral hilar opacity? Whatever you know, because it is given schema, so you have to utter at least three diagnoses over here. So, one is the can be parahilar mass, and other.
This can be a hiatus hernia, or there may be consolidation,
Hmm.
left-sided pneumonia, nodular mass may be there,
Also,
left parahilar nodular
can be
enlargement,
collapse also.
can be collapse, yeah,
Okay.
with blunting
So
of
you
left
have to
CPNP
utter all
muscles.
these things. collapse, it can be mass, it can be your the margin also not regular. So pulmonary edema can be there. There is a little the left atrial is obtunded, so there might be pleural effusion. Okay. Now, what is this image showing?
Riles tube in lungs.
Right lower zone
So
dizziness,
you will say that
consolidation,
the chest X-ray
or
showing
it's
that the
you going on
right
the
in the right contact with there
yeah,
is a
rest going
aspiration
on the right
only.
side.
Yeah. Anything else you are seeing here?
The rest going on the right side, right bronchus.
Right side. Yeah. And aspiration
And it
pneumonia
will
is
be,
there.
yes, sir.
And there is a calcification on the knuckle.
Aortic, aortic knuckle calcification.
Yeah. So what are the findings here?
Subcutaneous emphysema, post-sternotomy sutures with rib fractures.
It's a pleural chest. It's a
So,
multiple side with fracture on the right side with subcutaneous emphysema,
maybe
maybe
anything
pneumothorax.
else? Maybe
Used to
pneumothorax,
CBG
not me.
sutures. And there is a
Yes. Anything?
Also, sir, lung contusions are possible over right
Very
side.
good. Yeah, lung condition you have to utter. There is a rib fracture, there is a subcutaneous emphysema, lung contusion, the post-thoracotomy suture, and anything else you are
Catheter
seeing?
in the left
Left chest, there is a catheter. Yes. So whatever you will see, you will this things because there is no not get the marks. Now here, what you're seeing?
is right CBP line, endotracheal.
Yeah.
ECG leads with wires. So
You have seen the CVP line over here. Okay. Then you have seen
Riles tube.
this feeding
feeding tube.
right to a
There
little
is
lower.
IABP.
IABP, sir. IABP is there.
IABP.
There is a IBP.
Yeah,
You have to utter. If you miss this IBP, you will not get the marks. Okay. Here is the IBP and the other ECG leads. Okay. So very carefully you will check the chest X-ray. Now this is 45-year-old male after
Tension
road
pneumothorax.
traffic accident come to here. Unstable hemodynamics. What is happening here? Again.
Tension pneumothorax, sir.
टेंशन pneumothorax और क्या है?
rib fracture.
So there is a
ICD in situ.
subcutaneous
Select ICD in
emphysema. There is a
subcutaneous
pneumothorax. There is a chest drain.
pneumothorax.
Chest drain is there. This is pneumothorax, deep sulcus
ECG
sign.
leads.
ECG leads. Okay, and also there is a patient is
Endotracheal tube.
intubated. This tube is there.
Mediastinal shift.
Okay. Mediastinal shift. Yes. Tell me. 45-year-old woman was placed in emergency department, 3-day history of fever, rigor, cough, protective green sputum, oxygen saturation 6% on air, 91 oxygen. Her respirator 38 beat per minute, her temperature 38.4. She has no significant past medical history, has not had any recent hospital admission. So there is a air fluid level in the right side of the chest. So
With
hydropneumothorax, left
bilateral,
side there is infiltration. Yeah,
bilateral pulmonary infiltrates
yes. And
and air fluid in the
what is
air fluid level in the right hemithorax with
yeah,
intact CP angles and cardiophrenic and costophrenic angles.
yes.
No, sir. The left side CP angle is blunted, I think.
Left side CP angle is blunted. Right
Blunted.
side,
Right side also
maybe.
cardiophrenic angle is blunted, sir.
No,
Cardiophrenic.
here is present on the both side.
Now come to this one.
Mm,
Air under the
Air
diaphragm.
under diaphragm.
Yes, under
Gas
diaphragm.
under
Go to my
diaphragm.
diaphragm.
Yes.
Right diaphragm, air under right diaphragm is pneumoperitoneum.
Left also there. This is the
Left is also.
diaphragmatic line.
This can be in case of hollow viscous perforation or
Very,
post laparoscopic surgery.
very good. Yes. So you have to utter both the thing because there is no history given. Now here,
Pacemaker.
left
With
pacemaker
Correct.
or
Dual chamber pacemaker, sir. Both right and left. I'm able to see. And
Eyes.
Left phrenic no pulsive. Phrenic no press.
left-sided diaphragm is upward. So
Eventration of left hemidiaphragm.
yeah, and
Some tube is
where नहीं
here.
देख रहे हैं स्टर्नल वेयर नहीं दिख रहे हैं ये यहाँ पे स्टर्नल वेयर है पोस्ट थोरैकोटोमी वेयर है so biventricular pacemaker implantation along with the left-sided diaphragm upward indentation and next ये बताओ
hiatus hernia. The stomach is in the lung pleural cavity. Hiatus hernia. Sir, stomach seems in the pleural cavity.
anything else any other diagnosis
Das yesterday in the
so feature consisting of hyperinflated lung fin right side and left side your diaphragm is upward
The tension gastrothorax on the left side.
Fracture of the diaphragm and
this is
herniation.
the stomach gas this is
Das
stomach
gastric Here, maybe gastric outlet obstruction can be there.
No, gastric outlet obstruction, you will get, this is not the gastric outlet obstruction. This is the emphysematous lung with the left-sided, your diaphragm is upward, and this is the gastric, this is the
Bubble,
stomach.
Gastric
Yes.
bubble.
fundus cast shadow.
Yeah.
Fundus, yeah.
Tell-
It's the post thoracotomy. Patient endotracheal tube is in place. IABP catheter. Right-sided CBP line.
Mitral valve replacement. MVR.
Some catheter
Yes.
is
There is
also-
IABP inside
IABP
with
is
a
also
tip close to the aortic knuckle.
Intra-aortic pulmonary pressure
So
high in
position
position.
is okay. Position is
No,
right.
Position is too high.
too
Position
high.
is high.
Too high.
Okay. And anything else?
Some catheter is
Mitral
also
valve.
heart in pericardic space.
ECMO catheter.
There is some catheter is also there from below in the heart, pericardic space.
So
Right
who's
jugular.
taking catheter? Yes, ECMO catheter is there. Intubated the tube in the trachea. There is a IBP. There is a sternal where there is a valve in the
Mitral valve replacement.
mitral valve replacement is there, and there is a your central
ECMO
line.
cannulus.
ECMO cannula is here. Yes. Next. Just a minute. Foreign valve.
Right.
Bilateral extensor subcutaneous
Bilateral
emphysema.
emphysema with
Emphysema, ICD on the right side. Both side, bilateral ICD.
Bilateral ICD
And
with
pneumothorax present on
contusions, pulmonary contusions.
and right-sided pneumothorax also.
Pardon, और एक बार बताओ बोलो
the rib fracture is
Chest
also
trauma,
there.
bilateral rib fractures, bilateral ICD, pulmonary contusions, massive subcutaneous emphysema on both the sides, and right-sided. And
Yes.
sir, a little bit pneumothorax is also there, right side.
Right side pneumothorax is still not drained completely. There is right side deep sulcus present.
The mediastinal layer as well.
No more
Mediastinal
mediastinal.
no mediastinal wear here.
We don't have continuous diaphragm sign.
Actually,
This
lower
is
part
left side is the contusion of the lung. Right sided both side there is a pneumothorax, and the left side drain is little upward. Right side drain subcutaneous emphysema is there. And have you seen the rib fracture? Here is the rib fracture, right side.
Blow down is near the diaphragm.
What is this?
Pulmonary edema.
ARDS.
Bilateral homogeneous, not homogeneous, bilateral heterogeneous opacity is probably ARDS.
ARDS.
Here,
It can be pulmonary edema.
you utter this pulmonary edema because you have to give the at least 3 differential diagnoses. What is this?
There is ET tube in situ left side internal jugular vein catheter with an ECMO cannula and a Riles tube.
ECMO cannula, why you are telling ECMO cannula?
This is something else. It's not.
Maybe ET tube outer part
ET
is
tube is here.
component.
ET tube is here. This
The one
one.
on the right hemithorax, yeah.
Yeah. So this is a bigger cannula. Probably it is a ECMO cannula. And this is the Ryle's tube. And where here? What this where
Left side
for?
recipient.
There is a big where here.
This
Left recipient.
the hyperlucent structure I couldn't make out. So the other one which is called is Ryle's tube.
There is a center line over here. Left jugular
On the
line.
left subclavian, left
Left
IJV.
IJV. Left IJV is there.
This is a lead भी है. सर ये जो मोटा सा राइट साइड में ये कौन सा कैथेटर है? इक्मो?
ये राइट साइड का तो ECMO कैथेटर जैसा लग रहा है, बट व्हाई
लेकिन
दिस
ये सब
वायर?
बहुत अंदर जा रहा है.
दिस वायर किस लिए है ये इसको पता करना होगा एक
देखिए
बार।
राउंड साइड वायर भी दिख रहा है.
Is it VP shunt?
एक बार ना ये एक्चुअली मैंने ये सब हमारे डिपार्टमेंट का रियल ये है। हम एक बार ये वायर क्यों डाला था, ECMO पेशेंट का ही है, ये वायर किस लिए है एक बार पूछ के हम ग्रुप में अपडेट कर देंगे इसका, ठीक है?
ठीक है.
Because this there is another wire, you see, there is another wire.
अच्छा.
Next here.
LVAD,
So
Excuse me, what
mechanical
is the answer of
circulatory
the
support
previous
device.
slide?
device.
नहीं कोई आपने एलवेट बोला, ये एलवेट नहीं है।
Okay, sir.
Extra
Mechanical circulatory.
एलवेट में दो कैनुला रहेगा, एक लेफ्ट वेंट्रिकल से ड्रेन करेगा ये एओर्टा में, यहाँ पे आपको चार दिख रहे हैं। सो ये बाई वेंट्रिकुलर मैकेनिकल सपोर्ट डिवाइस, बाई वेंट्रिकुलर, बिकॉज चार लोब दिख रहे हैं आपको। सो इट सपोर्ट द राइट वेंट्रिकल एंड ऑल्सो द लेफ्ट वेंट्रिकल। ये बताओ।
Excuse me.
Yeah.
What's the previous slide the answer before this?
Biventricular mechanical device.
Before this slide.
This one.
Yes. What's the diagnosis again?
Diagnosis is basically it was a ARDS patient and ECMO going on. Okay. So this is the Ryle's tube. This is the central line.
Ryle's tube maybe is the small wire, and this large one can be BP shunt.
Let me check once. Okay. This I will check and I will get back to you in the group. Here बताओ.
The double Newman tube, NG tube, I can see bilateral ARDS.
And
the right side at ICD in place.
Right side there is a ICD, the bilateral pneumonia, the ET tube is there, and what is happening here? The Ryle's tube in the left side, so aspiration is there.
Yes, I can see the right tube coming down.
In the abdomen. So one tube in the abdomen also.
This tube in the abdomen. This can be your BP shunt, but the Ryle's tube, this one is the Ryle's tube entering in the left lung. See, it's entering the left main bronchus. This one. And your ET tube is here, up to here. This one. Okay. Now coming to another set of questions. So what is the device and what is the role in the ICU?
High flow nasal cannula.
High flow nasal
So
cannula.
high flow nasal cannula indication for use.
Used in acute hypoxemic
Hypoxemic respiratory failure.
purified, heated, humidified gases at high flows.
It can be
So
used for doing bronchoscopy if patient require high oxygen
okay.
support.
So you can support during the procedure, you can do
During
the
endoscopy.
pre-oxygenate during intubation, and you can give the type 1 hypoxic failure. So what is the disadvantage of this device?
And it is less, if
Can
patient
vary.
keeps
There
out, it provides less PEEP. We can provide up to 6 to 7 PEEP, not much.
Okay, and anything else?
I don't know what is the question.
Disadvantage or disadvantage, yeah. So we can't give the high PEEP, so we can't use in a type 2 failure.
Yeah.
Okay. Now, if you want to put the nebulization along with it, so how will you give the nebulization?
So from mouth we will give
No,
from
the dry limb, you have to put your nebulization at distally near the humidifier, okay? And how will you diagnose? How will you diagnose is a failure? This HFNC failure. Is
ROX
there any
index.
scoring
Rox
system?
index.
ROX
ROX
index.
index. Anyone can tell me what is ROX index?
PO2 divided by FiO2 divided by respiratory rate, that is called the ROX index. We measure it at 2, 8 and 10 hours after applying HFNC. If it is less than 3.8, then it is bad. I mean, higher, more than 4.8, then it is success of the HFNO.
Okay. So treatment hypoxic respiratory failure. Now 58-year-old alcoholic presented in the AR with a severe shortness of breath, profuse sweating for 4 preceded by chest discomfort. We thought was attributed to indigestion. What is your radiological diagnosis? Most likely etiology. What is the immediate treatment?
Acute coronary syndrome and pulmonary edema occurring because of it. Overload.
it's an application of NIV and give diuretics, give oxygen support.
So it is a pulmonary edema. Anything else? Most probably that. So always
Pneumonia, bilateral pneumonia.
bilateral pneumonia, pulmonary edema,
along with the
aspiration,
MRSA.
Pulmonary embolism.
Let me just.
pulmonary
No,
embolism.
can't do that, yeah.
Less likely, pulmonary embolism will not have this
Let me just finish.
infiltration. And your what is your immediate management? Immediate management, give NIV and
Diuretics.
So pulmonary edema, acute myocardial infarction, O2 diuretics, morphine, NIV or IPV. 54-year-old, 10 days post-operative following extended gastrectomy. What abnormality can you see? What is the possible condition could occur?
Hiatus hernia, and the complication can be chest infection
Hemothorax or hydrothorax
and
can be there.
atelectasis. Left-sided hiatus hernia, and the complication can be in the form of
lung atelectasis or chest infection?
So go systematically, then you will get at least some point. So the chest scagram showing that the left-sided homogeneous opacity with fluid air
Yeah.
level, and there is a left internal jugular line, and you can see any other tube. No,
So yes, it's a tube is there. Some
one tube is there
rest
here,
tube is there.
Sir,
and also
endotracheal tube is
there.
quite deep. I mean, it is extending beyond the carina.
The endotracheal tube is beyond the carina. So
This is
let's
endobronchial.
yeah. So small bowel in the left chest, keeping with left diaphragmatic hernia, strangulated small bowel causing bowel ischemia, aspiration pneumonia. This three is the your diagnosis. So initially, this is a X-ray of 2014. So that time the question was 3-pointer, 2-pointer, and 5-pointer. The answer, but nowadays all are 1 marks answer. Okay. So that's why it is giving 5 point, 3 point, and 2 point. Small bowel in the left side of the chest, strangulated small bowel ischemia, aspiration pneumonia. Now
The
coming
how
to
can
this,
we diagnose strangulation this small bowel?
uh, I don't know why they are telling the strangulated, but be, I don't know. Now here,
Cerebral edema.
Subarachnoid
Cerebral
hemorrhage.
edema.
This
Ventricular
subarachnoid
bigly.
hemorrhage with
Meninges ventricular.
subarachnoid hemorrhage with dilated
With
ventricles,
hydrocephalus.
hydrocephalus after developing as a complication of SAH. There is some pneumoencephalus also.
not pneumoencephalus. This one, this blackie.
Yeah, the anterior.
So subarachnoid hemorrhage and hydrocephalus as a complication. So management is airway breathing circulation and VP shunt and EVD. Now tell me.
Saddle embolus in the pulmonary artery.
Pulmonary artery, yes.
Pulmonary embolism.
Large pulmonary embolism. ओए ये कि सुबेंदु ठीक है सुबेंदु what is your diagnosis and definitive management?
Aortic root.
Is this an aortic dissection?
Aortic dissection.
Aortic dissection दिख रहा है चेम्बर अदर्स चेम्बर नहीं दिख रहा है हार्ट का चेम्बर नहीं दिख रहा है प्लैक्स व्यू बोला है aortic dissection प्लैक्स व्यू में नहीं आएगा
Aneurysm of aorta.
ये नो ये aortic dissection है दिया this one yes very good who said this very good aortic dissection ascending का Stanford A type
Stanford A.
this one aortic dissection
This one.
so first resuscitation BP management and surgery is the management here it is easy
Pneumothorax with consolidation of the right lung.
Pneumothorax, maybe contusion of the right lung, along with that subcutaneous emphysema.
Subcutaneous emphysema is there, and mediastinal shift towards the left side is also there.
yes so right-sided pneumothorax right-sided lung contusion rib fracture and chest drain insertion chest drain कहाँ दिख रहा है
Immediate action will be chest drain insertion.
yeah immediate action is ये
Ogilvy syndrome.
This large bowel distension.
This is
Ogilvy syndrome.
Colitis,
Colonic
Ogilvy
soda.
syndrome. Yeah. Ogilvy syndrome, CT abdomen, surgical consultation, tube decompression. This one,
bleeding,
Right psoas abscess.
swas bleeding.
immediate bola na.
Aortic
This is
dissection.
under
Retroperitoneal hemorrhage.
Femoral artery hemorrhage into the retroperitoneal.
ये retroperitoneal hemorrhage ही तो लग रहे
Right
हैं.
side.
This,
Hematoma.
so right-sided retroperitoneal bleed. Here. Right-sided retroperitoneal bleed. So blood transfusion, vascular surgery, angioembolization. What is happening here?
Severe mitral regurgitation.
Mitral vegetation causing severe mitral regurgitation.
Yes, vegetation is there. Heart failure, severe MR. यहाँ पे एक vegetation लग रहा है. So thank you all. फातिमा मेरे को next class कब दोगे? I want to take neuro cases. The most commonest case come to the EDIC 2 exam. One is subarachnoid hemorrhage. Second is your traumatic brain injury. Or third is your infection meningitis. Usually stroke they are not giving stroke, they give in during the subarachnoid. They ask about the vasospasm and the stroke management. Sometimes they might give the stroke in your CT where they ask. Usually the in long case subarachnoid hemorrhage or meningitis or traumatic brain injury. So when you are giving next class to me?
Sir, I'll let you know the date and then we'll be conducting. Morally in the first week of November.
No. You can give. I will be in the ESICM from 24th. I will travel. Anyway, you can give 2nd November. You give me 2nd November. I will take. If I take little late night, like 9 p.m. to 10 p.m., is there any problem to all of you?
No, sir.
No, sir.
So TCS case take little time. So I will take both the. I will do the both the cases, the subarachnoid hemorrhage and the TBI, traumatic brain injury. So in the subarachnoid hemorrhage, a lot of things to need to discuss. In the TBI also, lot of things to discuss, including your these things, the ICP monitoring things. Okay. So next I will take on 2nd of November.
Sure, sir. Thank you.
Thank you all.
Thank you, sir.
Thank you.